Morning. Welcome to my lecture in Pharmacology 2 with the subject of herbal medicine. To start with, this is Dr. Cabrera of the Perpetual Health uh, Medical Center Las Piñas, University of Perpetual Health, uh, Janelle Foundation School of Medicine. We'll be discussing about herbal medicine, and I would like to thank the Department of Pharmacology, Dr. Jose Burgos, for uh, providing me this set of slides, and I had some revisions and some additions. And let's proceed with the lecture. Okay. When you talk of herbal medicine, so we will be talking about herbs, of course, its usage, its byproducts, what would be their indications, and possible contraindications and even interactions. Okay. So, for definition, a herb is a plant or plant part used for its scent, flavor, or even therapeutic properties. They are manufactured and sold as tablets, capsules, powders, teas, extracts, fresh or dried plants. Herbs are crude plant materials, which include the leaves, the flowers, the fruits, seeds, bark, roots, or other parts which may be a part of the plant or the entire plant. They are fragmented or powdered, and herbal materials are defined as the fresh fruit juices, the gums, essential oils, dry powders, and herbal preparations are the basis for the finished herbal products, which may include comminuted or powdered herbal materials or extracts, tinctures, and fatty oils of herbal materials. Let's talk about safety and quality of raw materials of the plants, medicinal plants. First, we'll talk about the intrinsic properties. So intrinsic property is the genetic component. The extrinsic would be the environment where the plant grew, the methods of collection, the cultivation, harvesting, post-harvest processing, transport, and even storage. And contamination, especially those mishandled or grown by those who didn't really study the growing of safe medicinal plants, can have undeclared toxic and or hazardous substances. And of course, safety and quality of these materials, we should also discuss the risk for overdosage, especially those who are inappropriately used by healthcare providers. And as of the safety issues, there have been reports earlier of tainted or contaminated herbal products and even food like this one. Uh, the death of 30 kids in Bohol when when they ate uh, cassava that has been contaminated with pesticides. So this is the result of those investigations. So it was uh, the cassava that was used were contaminated with pesticides by the ones who produced the cassava, because the root and the pesticides are in the same area. Okay, Then let us now study the adverse events or interactions of such herbal products. Okay. The inadvertent use of wrong plant species can have adverse events, effects, or interactions. The allergic reactions that it can give, so you have to to be aware of that. The food and drug interactions, like you have to understand the absorption of the drugs or even of the plant substance that are in the plant. So there could be interactions with the medicines taken by the patient, and even the effect on the blood sugar. So especially those diabetics. Okay, so in diabetes is a chronic conditions that requires a lot of funds to control. So some patients are becoming desperate and are looking for alternative means of controlling their blood sugar. But unfortunately, if they are not well studied or they just listen to recommendations of friends or neighbors or relatives, without even consulting their physicians, if ever they have consulted their physicians, the physician doesn't know that could be a problem. It can have an adverse effect on the blood sugar if taken with their anti-diabetic drugs. Okay? Or there could be uh, preparations that are can enhance the effects of barbiturates. There can be preparations that interacts with cardiac glycosides, and there could be inadvertent contamination by microbial or chemical agent during any of the production stages. You remember the methanol toxicities lately, so the production was not they have not followed good practices, or even the storage. There could be fungal or mold contamination or growth that can give harmful effects to the consumers. Okay, you have to take note if there will be adulterants that can be added inadvertently or without unknowingly. There are, because there have been supplements that were adulterated with, like say, sibutramine. Sibutramine is are used in weight loss supplements at levels that is 3 times the maximum recommended daily dose. So you can have overdosage. And there are now in the net, especially it's now easy to acquire, just a click in your internet. With you can pay it cash on delivery or even with a credit card. Okay, there are several of the unapproved anorexic ingredients like appetite suppressants that are detected in dietary supplements have been linked to serious adverse effects, like this one, the presence of rimonabant, which is highly linked to suicide, and phenoproprex, which is both addictive and have a high risk to committing suicide. So you want to be slim, but later on end up killing yourself. Also, these are reports coming from the FDA. It says there are FDA warnings against unregistered fat burners. The fat burner HCA 500 capsule, which contains both amphetamines and sibutramines. So amphetamine, as you know, is shabu. So you won't be sleeping and you won't be eating. That's why it will be very effective. You will lose weight, but later on you will kill yourself, or you can have adverse reactions to your behavior and may later on harm yourself or harm others. Okay, also there are adulterants that includes furosemide. You know, furosemide is a diuretic. So they say that they can have lean muscles. Yeah, lean muscles, and you pee a lot and you dehydrate yourself. That's why your muscle fiber will show, and it will end up into dehydration and hypokalemia. And even they can be benzodiazepines added to the supplementation and other antidepressants, which must the side effects of stimulants, which will confer an increased risk of dependence. And of course, they could add steroids for pain relief. So you better be careful with the supplements that you're buying online, especially if you do not know the ingredients, or are they just coming from um, uh, unregistered or home-based production, which are not standardized if they have not undergone regulations. So better be careful. So because it might be cheap, it may seem to be effective, but later on you may do harm to yourself and to others. So let's now talk about the common extraction procedures that are involved in the productions of your herbal supplements. First is infusion. Okay, so infusion are is done when the plant material is placed in a pot and wetted with cold water, and later on boiling water is poured over it and left to stand, and it's covered for about 15 minutes, after which the tea is poured off. That's how you produce your tea. So wet with cold water, then pour boiling water, cover it for 15 minutes, and that you'll be producing tea, and it will be your decoction. Decoction is done when the crude drug is boiled in a specified volume of water for a definite period of time, and later on that will be cooled and filtered, and it is now suitable for extracting water-soluble, heat-stable plant constituents. Next would be your maceration. Maceration is when occurs when whole or coarsely powdered plant material is placed in a closed container with extracting solvent and allowed to stand at room temperature for a period of time with frequent agitation until the soluble matter is dissolved. Then later on, after the process, the mixture is then filtered. That is maceration. Next would be percolation. So it is like extraction, but it's more uh, uh, it's more exhaustive. So it's termed as the exhaustive extraction for the purpose of obtaining soluble parts of the sample by passing a solvent through it. Next would be digestion. It is also considered as maceration, but at a relatively elevated. So the maceration is done at room temperature, while digestion is done at a relatively elevated temperature. These are usually suitable for hard barks or woods, which are difficult for water to penetrate. Next would be your Soxhlet extraction, wherein compounds of low solubility is needed to be extracted from a sample matter. Next would be liquid extraction, wherein it is this liquid extraction is used to extract and separate compounds based on their relative solubility in different immiscible liquids. Now, let's talk about the 10 halamang gamot, or the 10 DOH approved herbal medicines. So this is approved. So it is studied to be safe and effective. Now, so these are the 10 herbal medicines. The acronym is Santalubi. Santalubi means Sambong, Acapulco, Niyog-Niyogan, Tsaanggubat, Ampalaya, Lagundi. ulisimang bato, bawang, bayabas, and yerba buena. Discuss each herbal medicine. Okay, let's talk about sambong. This is a well-known herbal medicine. It is well used in the rural area. Sambong is the scientific name is Blumea balsamifera, and so the English name is Bulmea campora. So, what are used in what part of sambong is used? It's the leaves. So the leaves are used as diuretic, and it is now known to dissolve kidney stones, or it can remove nephrolithiasis. That's why now there are now sambong tablets that are sold in the market. So the herbal preparation is through decoction. The dosage is at least with the boiled leaves. You consume 125 ml, or approximately 4 ounces, 3 times a day after every meal. Now let's talk about Acapulco. The scientific name of Acapulco is Cassia alata, otherwise called your bayabasan. Okay, for Acapulco, the therapeutic effect of this herb is it acts as an antifungal. The common herbal preparation would be an ointment, and the dosage should be it is used twice a day on the affected part. And there's a precaution. It's good it was studied that decoction are not good for pregnant patients. Next would be your niyog-niyogan, or your qualis indica L, or the common English name is Chinese honeysuckle. For this plant, the therapeutic would be there's several. Okay, first is the fruit. Okay, the fruit can expel intestinal worms, and it is eaten as is. They have dosages. Okay, for adults, you can consume 8 to 10 kernels. For ages 9 to 12, 6 to 7 kernels. 6 to 8 years old, it is 5 to 6 kernels. And 3 to 5 years old, it is 4 to 5 kernels. Precaution for this, the fruit would be, it can cause hiccups. Next would be the leaves. Okay, the leaves are used to treat toothache. It has an antiseptic property. It is also an anti-diarrhea, and it can even alleviate headache. So what you can do is you can prepare decoction or poultice. So the dosage for or applications for toothache, you can gargle. Okay, you can directly wash wounds. You can take it 3 to 4 times a day, or directly apply to the forehead. Okay. Again, it can cause hiccups. Let's move on to another herbal preparation or another plant. It is called your tsaanggubat. The scientific name is Eretia microphylla lam. So the what is used in tsaanggubat are the leaves. It has astringent property. It can help to have stronger teeth and can act as an expectorant. So common herbal preparation is decoction. How do you, what's the dosage? You gargle daily with 125 ml, 2 to 3 hours. So yeah, you can have stronger teeth gargling but every 2 to 3 hours. Next would be our favorite, okay? our favorite part of um, pinakbet. It is one of our food. It's ampalaya. Scientific name is Amordica charantia. English name bitter gourd. The therapeutic effect of ampalaya is that it lowers blood sugar. The common herbal preparation would be decoction or eating stem leaves. Okay, so the dosage should be 1/3 cup 3 times a day, or 1/2 glass full of stem leaves twice a day. Next would be another common, well-known now. It is now sold in the market in syrup forms and even tablet or capsule. It is your lagundi. Scientific name is Vitex negundo. Uh, English name is this is the five-leaf chaste tree. So for lagunti, it has expectorant properties. It can relieve sore throat. It can serve as a diuretic, and it induces menstruation. Is this an abortifacient? I don't know. It prevents gastric colic, and flatulence. So common herbal preparation would be decoction, and it is used. You can drink it, gargle it, but there's a precaution. Only use the five-leaf variety. Now, it's now sold in the market in syrup preparation. But mind you, the syrup is can only be used for children above 2 years old. So never use. This is a rule. Never use herbal preparation in children unless it is included in the uh, 10 herbal medicine recommended by the Department of Health, because it has gone thorough um, efficacy and safety, okay, studies. So don't ever use uh, herbal medicines in children, particularly babies. We don't know their possible side effect. And next would be a common, this is a common plant in our garden. This is your Ulisimang bato, or called your Peperomia pellucida, otherwise called your pansit-pansitan. Yeah, it's a common weed. Actually, it's a weed, but it's an herb that is very good. So, what can we use with Ulisimang bato? You can use the leaves. It has anti-rheumatism and anti-gout. So, it's good for those who are suffering from gout. So, you can eat it as salad. Yes, it is very fleshy. How do you do it? Eat 1.5 cups of fresh leaves daily. Next would be part of our part of our spices would be the bawang, or your allium sativum, or garlic. So the therapeutic effects of garlic would be can lower blood cholesterol level. But I think there have been studies that it you do not really use it in individuals that has already high cholesterol. Yeah. What you can do it can prevent increase of cholesterol in formerly normal individuals which has high risk of developing hypercholesterolemia. So it is still good to use your statins to decrease the cholesterol, but once it is normal, then you can now use your garlic to reduce or to control cholesterol level. It can reduce pain from arthritis, reduce pain, toothache, headache, and rheumatism. It also has antiseptic property. Maybe this is the basis of those in the rulers that uses garlic as part of the management of dog bites, which is wrong. Okay, you do not for dog bites. You just wash it with soap and water, and let the doctors or the one who are in authority look at the wound, and if it needed to be, you should be given your anti-rabies, anti-tetanus shot. Okay. Common herbal preparation for garlic would be, it can be fried, it can be roasted, it can be soaked in vinegar. Yeah, that's one of my favorite. It can be blanched in boiling water. So how do you, what's the dosage? Use 2 pieces of garlic clove 3 times a day after meals. Well, thus you can have issues with the smell later on. Okay, so precaution: you should avoid taking it with those drugs that lowers blood sugar or with your blood thinners. Okay, do not use it with blood thinners, and there's a risk of developing stomach ulcers if you continuously eat garlic raw. And next would be a fruit. Yeah, it's your bayabas or guava. Yeah, it's a very good source of your vitamin C. But aside from the delicious fruit that it gives, you can use the leaves, okay? Because the leaves has anti-diarrhea and antiseptic property. This is a common herbal preparation that is used in the rural during circumcision and during management of wounds. Okay, so what they do, they make decoctions, okay, and the dose would be for diarrhea is you consume 125 ml every 3 to 4 hours, or you can directly wash wounds. Okay, so precaution, because it is an anti-diarrheic herbal medicine. Of course, it can cause constipation. Next would be your yerba buena or your Clinopodium douglasii. The English name would be, it is your peppermint. So for the peppermint, what we can use are the leaves. So peppermint can relieve headaches, toothaches, and joint pains. So again, you can do decoction. Application: take a cupful every 3 hours. If you have headache, toothache, or joint. And of course, there are other herbal preparations that are used in the countryside in a rural area, endorsed by our elders. But at least these herbal preparations or the sources are safe, since they can be eaten. They're part of our food, like your saluyot, which has anti-inflammatory property. The ginger, has anti-inflammatory property and is known to decrease hair loss. Virgin coconut oil, though this is quite now, is now a good this one has a lot of usage, like your virgin coconut oil is a very good source of your saturated medium chain triglycerides. It can regulate blood sugar, and it is said to lower viral load among aged patients. It has antiviral, antimicrobial property. It helps hepatitis C, herpes patients, helps maintain healthy thyroid function, maintains cholesterol levels, heals and nourishes the skin, hair, and scalp. And again, another one of our favorite would be our malunggay. Okay, malunggay. So this is also one of our food, but for malunggay, you can use all and almost all. Okay, all the parts of the tree. Okay, you can use the leaves. Of course, we do use the leaves for our food and the fruit. Okay, but in malunggay, you can also use the roots, the seeds, the bark, and the flowers, and even the immature pods. So this can act as cardiac and circulatory stimulants. It possesses anti-tumor, antipyretic, anti-epileptic, anti-inflammatory, anti-ulcer, antispasmodic, It can be a diuretic, antihypertensive, cholesterol-lowering antioxidant. It has anti-diabetic properties. It is hepatoprotective, antibacterial, and antifungal. So it's almost a miracle plant, but still, you need good researches for such properties so that we can now add it among the DOH approved herbal medicine. Of course, now we go to the now it's dengue is quite endemic in our country. So before it was just during the rainy seasons, but now you can see dengue perennially. So one of the favorite now, and though it has a similarly good result, but you have to be cautious about the use of this one because there have not been a very good research regarding this one. Your TawaTawa, otherwise called your Euphorbia hitra. Okay, so otherwise other TawaTawa has been very popular nowadays because of our desperation due to the high cases of dengue. So we are a high burden country for dengue. So your tawa-tawa is otherwise called your gatas-gatas. This is a hairy herb grown in open grasslands. It's really found along the lawns, the roadsides, and pathways. It is considered one of the most popular folkloric treatment. The word is folkloric treatment for dengue in the Philippines. It came about when there it's yeah there have been a research for tawa-tawa. It's done by pharmacy students of your University of Santo Tomas. Okay, Faculty of Pharmacy conducted a study entitled Investigation of the Antithrombotic Property of Euphorbia hirtalin, otherwise called our tawa-tawa decoction in rat models. Still no human studies. Okay, so the methodology is that in summary, they use chloramphenicol, ethanol, and heparin to induce thrombocytopenia on rat models. They are not infected with dengue. They just induce thrombocytopenia as if mimicking dengue hemorrhagic fever. So there is no infection, rather than it is more of a drug reactions. Then they administered tawa-tawa decoction to the sample groups and collected blood samples to check for platelet count, bleeding time, and blood clotting times in several stages of the experiment. So, the conclusion, it was noted with the rats and with the type of how they induce thrombocytopenia is that tawa-tawa was able to promote cell production and prevent platelet destruction. So this can be a very, very good herbal preparation for our dengue cases, but we have to be very careful because it is still in the animal studies, and there could be very much difference with the mechanism by which thrombocytopenia were induced. So thrombocytopenia with the dengue virus, it's much more different from the thrombocytopenia induced by the medicines, and of course the models are still, so this is still good for the rats. So we are still waiting for good clinical human studies, which will be very quite hard to do. So if you are still interested, so I have seen this one in the net. So there are, if you want to explore more about the medicinal plants in our country, you can have this book by Ludivina S. de Padua, the Philippine plants, the medicinal plants. And of course, now I'm done with my lecture. Maraming salamat po. You can always watch this in my YouTube channel. Don't forget to subscribe, click that thumbs up and your notification button. So, till the next lecture, have a great day.